Okay.
Hi, Dr. Laura. Thank you for joining us today.
My
We are
pleasure.
truly honored to have you here with you. So, I will introduce yourself as you are a physician, researcher, and policy expert known for your pioneering work in the field of One Health, which focuses on the interconnection of human, animal, and environmental health. You has contributed extensively uh, at to understanding how global health risks emerge at the interface of these systems and has been actively involved in promoting interdisciplinary approaches to prevent future pandemics. Your work places medicine, veterinary science, and public policy. You are the key voice in One Health movement and you are co-founder at One Health Initiative also. So, with your permission, now I would like to ask you some few questions.
Sure.
Okay. So, my first question will be what first made you realize that medicine and veterinary sciences could not continue working in separate silos?
It was the West Nile virus outbreak in New York City in 1999. You had two separate outbreaks going. The first occurred in birds, primarily crows. Crows were starting to get sick and dying in a neighborhood in Queens by the thousands, and nobody knew what to make of them. And then people started getting sick, very sick, with similar neurologic problems. And the virus spread north to the Bronx. This is in New York City. It has a number of different boroughs. And it started affecting birds in the Bronx Zoo. And at that time, the chief veterinary pathologist, Dr. Tracy McNamara, was getting very concerned, and she was doing necropsies on some of the birds that were getting sick and dying. And she discovered horrific hemorrhagic encephalitis and myocarditis, and was concerned that this might have zoonotic implications, meaning that this infection could spread to some of her staff. But at the time, the working diagnosis for the people who were getting sick was St. Louis encephalitis, which is a common mosquito-borne disease. Not common, but I mean it's endemic in the North America. But she felt that this might be something new. And the reason why she felt it might be something new was because she had two different populations of birds in the zoo. One population were birds that were native to North America, and one population were birds that were native to Europe and to Africa. Now, if the disease were indeed due to St. Louis encephalitis, the birds in North America, where the virus is known, should have been fine. And the birds from Europe and Africa should have been the ones getting sick. But the exact opposite was happening. The birds that were native to North America were getting sick and dying, and the birds that were native to Europe and to Africa were fine. So she suspected that this might be a novel virus that had somehow migrated from Europe and Africa to North America, although she didn't know how that might have happened. And so to share her concerns, she called up the Centers for Disease Control in Atlanta to tell them about her findings. And they responded by telling her, well, you're a veterinarian and you're telling us, diseases of animals, and
Yeah.
we don't really care. That's not our purview. We only care about humans. And they told her to contact people at an agricultural lab in Iowa. Well, she wasn't happy with their response, and so she called up a colleague at the U.S. Army Medical Research Institute for Infectious Diseases in Frederick, Maryland, and told her her same concerns. And they asked her to send some of the specimens to them to examine because they had state-of-the-art capabilities. And so she did, and lo and behold, she was right. The diagnosis turned out to be West Nile virus, first time ever in North America. So here you had a case of a veterinarian who sounded the alarm because the animals were telling us something, but they were being ignored. And it had profound implications for human health. So that was really a bellwether event for me on the importance of animal health, the role of veterinarians in addressing zoonotic diseases such as West Nile virus and all the other zoonotic diseases that are diseases of animals that can spread to humans. And it's not always a one-way street. Tuberculosis, for example, is originally a human disease that humans spread to animals. So it was that event, the West Nile virus outbreak, that really set off alarm bells in me that the current situation was not a good one.
Yeah, thank you for explaining this topic very well. That veterinary medicines and human medicine is correlating to each other along with the environmental science. So now my next question will be: if you are beginning your career today, what would you do differentially to make a greater impact in one health?
Well, growing up, I wanted to be a veterinarian. So
So
that
your
didn't happen.
childhood dream was a vet.
I wanted to be a veterinarian growing up because I love taking care of animals.
That's
That opportunity did not come to pass, and I went into human medicine instead. But my interest in animals never waned, which I think helped prime me for my interest in zoonotic diseases. But I think I'm not saying it's impossible to have an impact in One Health as a human physician, but it's harder, particularly in here in the United States, for example. Healthcare has got a lot of issues and extremely specialized. People who are in epidemiology, people who are in infectious diseases, they can certainly have a big role to play in One Health. But I think the veterinarians, the wildlife biologists, people who are involved in animal health, and inherently in their education and training, probably can have a bigger impact in One Health than somebody who just focuses on one species, which is humans. I think if you are in human medicine, getting a degree in public health, in epidemiology, to help you look at herd health rather than just at individual humans, which is the training that you get in human medicine. Learning about more than one species, I think, is important.
Yeah, exactly. Like we will be understanding so many diseases in different species, and we will be correlating them.
That's
It.
right.
Thank,
That's right. You get a
thank you for your explanation.
your education and training is inherently One Health in veterinary medicine.
Yeah, like I am currently having a subject related to veterinary public health.
Perfect.
So that, yeah,
Yeah,
in that subject we will be correlating a zoonotic disease. Like one disease can be transferred from horse to equine to bovine, for example.
exactly.
So my next question to you will be: where do you think we are still falling short in translating One Health into practice?
Well, at least here in the United States, I know that funding for veterinary medicine for animal health is far less than in human health. That seems to be the case
Yeah.
in general. Uh, and the policymakers don't appreciate the fact that human health is inextricably linked to animal health, to environmental health, and it's the best form of prevention of diseases to make sure that the animals and the environments and plants around us are healthy. But they're severely underfunded, just the way public health is underfunded. And we tend to fund primarily tertiary care after the fact, after the disease has already set in. So we're not good at prevention. And I think until we overcome that obstacle, it will continue to be a challenge to make One Health as robust as it can be.
So I guess even developed countries are facing funding issues for public health.
Mhm.
Okay. So my next question for you will be, why do you think veterinarians remain underrepresented in public policy discussions?
Well, unfortunately, there's a level of prestige associated with medicine compared to veterinary medicine. Humans tend to like to prioritize themselves.
Yeah.
Similarly, with the funding issues, we tend to prefer funding humans, um, and we prefer funding disease rather than prevention. So, similarly, veterinarians, at least in the US, I don't know about other countries, they don't have as much social prestige as human physicians,
Yeah.
as I said. And so they're not generally listened to as much as people who focus on humans. So that's
Yeah.
a big challenge. That has to
We
be
have to
overcome.
overcome this. Yeah. So my next question will be regarding the like previous outbreak we have come across COVID-19. So I will ask the question: what is the biggest lesson we should carry forward from COVID-19 for future outbreaks?
Well, there's been a big controversy over the origin of the
Yeah.
pandemic, and I wrote a book investigating that, One Health and the Politics of COVID-19, where I did a One Health in-depth investigation, and uh, and and I did not have any access to any classified information. It was all over the publicly available data.
Okay.
And from that research, I found that the most likely explanation is that it came from a laboratory, that it came from research on SARS doing what's called
Yeah.
gain of function research, which is basically giving a virus enhanced capabilities for whatever reason. And my conclusion is that the risk of gain of function research on pandemic potential pathogens far outweigh the benefits of that type of research, and that it just simply should not be done. Some
Yeah.
research projects are, just because some research projects can be done doesn't mean that they should be done. You have to look at the ethics, you have to look at the risk benefit ratio. And this type of research just simply should not be done. The risks are too great. Now, that does not negate the need for a continued One Health approach, because naturally occurring outbreaks and epidemics continue to occur.
Yeah.
So we need to continue a One Health approach, doing surveillance of wildlife, of livestock, of domesticated companion animals, even on potential zoonotic spillover risks. That we need to do an all hazards approach for both
Yeah.
naturally occurring and for better oversight of research laboratories that are doing risky research. They should not be doing that kind of work.
That's great to know from you. So, as many students want to have a career in public health, One Health.
Mhm.
So, what habit would you encourage veterinary and medical students to develop early in their careers?
Well, I think it's important to get to know each other. For students from veterinary medicine and from human medicine to develop friendships, to get to know each other, to trust each other, and so that way, when they're in their during their career, it's easy to call somebody up and say, hey, what do you think about this? Or maybe even develop a collaborative effort in working to reduce problems, food safety and security issues, zoonotic diseases, vector-borne diseases, antimicrobial resistance. These are all issues that require multidisciplinary input, where people with different backgrounds can work together. So reaching out across the species divide to those getting different training of yourself, and fostering One Health clubs. I think, as a student, there's lots of opportunities to raise
Yeah.
awareness, to spread the word, and to get people engaged in these types of issues.
As you mentioned collaboration, that's where wildlife bus come. Like we are making so many students from different background to know about One Health. So that's
Mhm.
how it will be reached out to so many people.
Terrific.
So we can share our research works, we can share our universities research and publications to each other, so that we will be getting to know about this.
That's great. That's what needs to be done.
Yeah. So my next question to you will be, how did you develop the ability to communicate scientific ideas effectively to policymakers and the public?
Well, one thing that I realized very early on during my academic career is that people are hardwired for stories, not statistics. So if you become a good storyteller, it's much
Yeah.
easier to convey information than just simply spouting off numbers or statistics. People's eyes glaze over when they start hearing numbers or looking at charts. But if you tell a story with lots of pictures, you get their attention, and it's a more effective way to communicate.
Yeah, that makes me understand that social interactions among peers and colleagues make you more communicable.
Absolutely.
So, as so many research are going on that we should not do, as you have mentioned earlier. So, my next question will be regarding that. Which emerging One Health challenge concerns you the most over the next decade?
What greatly concerns me is climate change and its
Yeah, that's
impact on food safety and security. Climate change is the greatest threat that we face. Uh, our entire civilization depends on a climate that's conducive to agriculture, where we can grow our food. The plants require a certain climate temperature. If it's too cold, they die. If it's too hot, they die.
true.
They need rain. They need rain in just the right amount without being drowned out through flooding or without being dried out through drought. So it's a very fine Goldilocks, level, if you will, where the plants need to, survive for us to plant and grow and harvest for our food and for the food of the domesticated animals that we rely on for animal proteins. So if the climate, and there have been cases, there's a reason why we didn't have agriculture before 10,000 years ago. That was
Yeah.
the Ice Age. So the planet was too cold, and people were living a barely subsistence existence. When the planet inexplicably warmed 10,000 years ago, that's when agriculture was developed. There were a few periods of aberration during the little mini ice age in the 1300s to the 1700s, where there was widespread crop failure and famine and war because the climate was so bad. People were, killing each other over diminishing resources and food. And so it was a very serious time. And that was just a tiny blip below the baseline
Yeah.
that we've been living on, this Holocene baseline that we've been living on for the past 10,000 years. And now we've risen up above this baseline by about 1.5 degrees, and we are seeing the effects. And it's not beneficial for agriculture. And as I said, agriculture is the foundation of civilization. And if agriculture collapses for whatever reason, so does civilization. So it's a very, very dangerous time that we're living in right now that has me greatly concerned. And so, we need to stop burning the fossil fuels, get off them ASAP. This is a global crisis. Using solar power, using other types of energy, anything but fossil fuels must be implemented as soon as possible to try to curtail further warming of the planet. It's a very, very dangerous time right now, and that actually gets me to, I'm losing sleep worrying about the future that we face if we can't do this. Some places will become, I was just going to say, some places are going to become uninhabitable. I'm sorry, what were you going to say?
Exactly, as you mentioned about climate change and biodiversity loss is also an upcoming One Health issue. We, India citizens, are facing that El Nino effect in our life. Like in summers, that usually temperature is bearable, but this time summers were unbearable for us because of the El Nino effect, because of climate change and biodiversity loss.
That's right. So this is a global crisis, but our political leaders are not rising to the occasion to address it as quickly as possible, and it's quite devastating to witness this.
Yeah. So as One Health students, and we should ask, we should make people encourage about One Health and support One Health, make climate change and biodiversity loss as much as effect we can create among people.
Exactly.
So, my next question towards you will be, what makes multidisciplinary collaboration truly successful?
Well, I think equitable funding. If you can get funding equally divided between the animals, the people, and the environment, that would make it more truly successful for a true equal collaboration.
I think social status is also necessary for the funding.
Mm-hmm.
As veterinarians are not having equal social status among medicine students, so that's how.
Yeah, so that's a challenge that has to be addressed.
Yeah. So, as an Indian citizen, I want to ask you a question. Where do you see India's greatest opportunity to become a One Health leader?
Well, India is a great civilization, very lengthy civilization, very proud civilization, has contributed much to the world. But it has many challenges. And one is that it has a microbially dense environment. And by that, I mean particularly fecal waste, lots of fecal waste from the animals, lots of fecal waste from the humans. There are some sanitation systems, but there's no sanitation system designed to deal with all the animal waste. And when you have all that fecal waste around, it contaminates environments, it contaminates waterways, it releases gases, greenhouse gases too. And so you've got a lot of foodborne and waterborne illnesses as a result. Yeah. You've got childhood stunting as a result, and it's, off the charts compared to other countries in terms of the level of stunting just from living in such a microbially dense environment. So I think if India can overcome that and show how it can be done, I think that would be a huge boon to One Health on how to improve your environment, how to make your environment more sustainable. and healthier
Yeah.
for both the humans and the animals. So if India can do that, I think all of that is what's keeping India from reaching its full potential as a country, as a society, is the illness that results from all that fecal waste.
As for India as a developing country, I guess we have to encourage people to adopt a sustainable development in their life.
Right. Well, plus, having now, I'll have to admit, I've not been to India, so I haven't witnessed it firsthand.
Yeah,
But my understanding is that, with all the animals wandering freely, uh, defecating,
on the
people
roads. Yeah,
defecating, it's a very, as I said, microbially dense environment that produces a lot of disease, which is not beneficial for either the humans or the animals living there. And that promotes then antibiotic use, which I believe antibiotics are available over the counter, which contributes to antimicrobial resistance. And India has some of the most resistant microbes in the world because of those practices. So if they can address that, they would truly be a global leader in One Health.
okay. So my next question to you will be, what would success for the global One Health movement look like 10 years from now? Like in next 10 years, what do you think the global One Health movement will look like? How will it will develop?
Well, if the policymakers make it a priority, it would be great to see fossil fuel use being curtailed so that we can stabilize our climate, improved food safety and security. We have to figure out how to feed ourselves without destroying the rest of the natural world. We need to ensure our food safety and food security. And that includes ensuring, biodiversity and maintaining intact ecosystems. We only have so much land on the planet, and we need to figure out
Yeah,
how to use it maximally while maintaining the soil. Soil health is needed for plant health, for crop growth. So it's all connected. It's all
yeah,
connected. So if we can improve that, reducing zoonotic disease emergence through further deforestation, through poaching and the consumption of endangered animals that might be harboring deadly zoonotic diseases. If we stop doing gain of function research on deadly zoonotic pathogens, if we do all of these things, that would be a One Health success.
yeah,
Increase
exactly.
surveillance of these diseases.
So I guess we are having time constraint. I will ask you the last question, and we will conclude the session here. I will gonna ask: is there any one book or paper or any resource you would recommend to every One Health professional or any One Health enthusiast?
Well, there's several books that people have written. There's websites. There's the One Health Initiative website, certainly, that my colleagues and I
Yeah,
run. There's the One Health Commission website that has a lot of information on educational and sometimes employment opportunities. So those are certainly useful resources. There's the One Health, both the World Health Organization,
World
World
Animal
Animal Health
Organization.
Organization, the quadripartite between the UN Environmental Program and the UN Food and Agriculture Organization. They certainly have a lot of information about One Health. So it's a moving target, and information is changing rapidly.
Yeah,
So those are all resources that are, I think, very useful for people who are interested in the subject.
yeah. So I guess we should conclude here.
Mhm.
So So thank you so much, Laura. It was really insightful and inspiring to hear from you today. We are really grateful to for your time, and we hope to continue engaging with you in the future and more collaborations.
My pleasure. It was a pleasure talking with you, Sneha. And I
Thank you
wish
so
you
much.
great success and
Yeah,
continued engagement with the One Health Nexus with the Wildlife Buzz. So my pleasure speaking with you today.